two vaccines to treat COVID-19. Both Pfizer and Moderna have received what is known as an EUA, Emergency Use Authorization from the FDA, and their vaccines are both safe and effective. You may also have read that the state is creating a statewide network for vaccine distribution and has broken the state into 10 regional hubs. We are the Capital Region Hub, made up of 8 counties: Warren in Washington, Saratoga, Schenectady, Rensselaer, Albany, Columbia, and Greene. And those 8 counties account for approximately 1 million people. And we are known as the Capital Region Hub. Each hub has a lead entity, and Albany Medical Center has been identified by the state to be the Capital Region Hub lead, and that is a role that we are very proud to take. Broadly defined, a hub has a few critical roles. First and foremost is the creation and the implementation of the Regional Vaccine Administration Plan, as well as the formation of a Regional Advisory Task Force. The task force, which will have its first meeting this week, is composed of approximately 60 members from the region from various constituencies. They represent county health department commissioners, trade associations, healthcare entities, government agencies, first responders, faith-based communities, community organizations, the Chamber of Commerce, insurers, and elected officials. In partnership with the State Department of Health and local community organizations, and with insights that will be provided by our task force, we will ensure that the vaccine is distributed safely, equitably, and efficiently across the region. And our distribution plans will be broad and they will be inclusive, with particular focus on our vulnerable and our underserved and our at-risk populations. The vaccine is safe and the vaccine is effective. We know it is safe because the side effect profile for those who received the vaccine during the trials, as measured, was minimal when compared to the placebo, and those side effects were non-threatening. We know it's effective because for those who received the vaccine in the trials, far, far fewer of those people got COVID, were admitted, or succumbed to the virus, including death. So I repeat again, the vaccine is both safe and effective. And therefore, we stand here today united to encourage all the members of our community, when it is their time, to become vaccinated when it's available. We must all do our part to protect each other from the virus. For example, Albany Med is leading by example. Last week, we began to vaccinate members of our workforce who have been on the front lines caring for COVID-19. I've used a tiered approach that was laid out by our Alden March Bioethics Institute with recommendations from the state. As all other area hospitals have done, we started with staff, clinical and non-clinical, who are on the front lines, including areas like the emergency department, ICUs, and units that treat patients with COVID. To date, on this campus, we have vaccinated close to 1,000 people, and we obviously have a significant amount of work to do just this week alone to vaccinate the next round of people in our tiered approach. And the same is true for all the local area hospitals as well. Before I turn over to Dr. Venditti, let me give you some takeaway points on the vaccine. Again, it is safe. Both Pfizer and Moderna vaccines have been approved by the FDA, as well as an independent task force commissioned by Governor Cuomo in New York State. The community should not be afraid to take the vaccine. 2, clinical trials on the vaccine included tens of thousands of people from various backgrounds. Participants came from diverse racial and ethnic backgrounds, an array of health conditions, and it was proven to be safe and effective in all of those populations. 3, very importantly, if you have had COVID, you are still encouraged, and it's recommended that you still get the COVID vaccine. The CDC recommends that even if you have developed antibodies. 4, everyone who would like to receive the vaccine will be able to get it. That is the work of the hub. That's the work of the Regional Advisory Task Force to make that happen. Furthermore, no one will have to pay for the vaccine. 5, very importantly, the vaccine will not give you COVID. None of the vaccines can actually cause the disease. while there are some reported side effects such as fever, fatigue, and muscle ache, these are the signs that the vaccine is working. This is not evidence that you have gotten the disease as a result of the vaccine. And finally, and most importantly, 6, this is the beginning of the end of the pandemic. When enough of us receive our vaccine in the region, we can resume life as we knew it. And in the near future, when we move out into the community, know that others before you, including people in this room, have already done their part by taking the vaccine. If we put this pandemic behind us, we must all receive the vaccine if we are eligible. At this point, I'd like to introduce Dr. Fred Venditti.
Thank you, Dr. McKenna. I'm Dr. Fred Venditti. I'm the hospital general director here at Albany Med. Clearly, the arrival of the vaccine is an absolutely tremendous event for us. But remember, the full benefit of the vaccine is not going to be felt for 6 to 9 months. Okay? So we can't lose sight of the need to continue to be vigilant in our daily activities. What does that mean? It means wear a mask. I hate wearing a mask. I think all of you probably hate wearing a mask. It's still important to wear a mask. I still wear it. If you don't wear it all the time, if you wear it 80% of the time, you're still at risk. If you don't wear it right, you're still at risk. Wear a mask. The other part of the vigilance is social distancing. Don't go into settings where you can't distance from other people in those settings. And finally, as I keep saying every time I mention this, as my mother would say to me as a kid, wash your hands, wash your hands, wash your hands. So Dr. McKenna mentioned that we have a regional call every day amongst all the hospitals, most of which are represented here. We talk about our case volumes, we talk about our capacity, and we share plans, whether they're care plans or other kinds of plans. Today in our region, we're caring for 417 COVID-positive patients. Yesterday, that number was 401. On Sunday, that number was 391. There are 70 patients today in intensive care in our region. So today, our capacity to care both on the med-surg floors as well in the ICU is adequate. But as you can see from those numbers, there's continued growth in the frequency of patients getting admitted into our hospitals with COVID. As a result of this continued growth, yesterday we had a very good discussion amongst all the hospitals where we agreed upon a plan to begin to reduce non-urgent surgery cases that require a stay in the hospital, whether that's 1 day or several days. You can think of surgeries in perhaps 4 different ways in terms of the need for hospitalization. Ambulatory surgery is ambulatory. You come in, you have your procedure, you go home. You don't need a hospital bed. Extended stay surgeries are a little bit more complex surgeries that require, on most occasions, an overnight stay. You go home the next day. So 1 day in the hospital. Same-day admission surgical cases are even more complex and require usually multiple days and even on occasion a day or 2 in the intensive care unit. So those kinds of surgeries actually consume a lot of hospital capacity. And finally, there's surgery that might be needed when you're already hospitalized. So you've come in for some reason and the decision is made that you need to be operated upon. What we were talking about in terms of limiting non-urgent cases are those middle 2, the extended stay and the same-day surgery cases that when they come in will need hospital stays of some degree. Obviously, if you're in the hospital and you need a surgical procedure, you're going to get that procedure before you go home. And if your medical condition dictates that you need to be operated upon, regardless of what category you're in, we're still going to do that. But we're going to begin to decrease the amount of surgery that's performed in the region. And that's going to happen. It's actually started today, and it's going to carry forward through next week. Next week, on Monday, we've agreed that we're going to get together again, and we're going to assess where we are in terms of growth of COVID patients in the hospital. And what we're going to be doing is making a decision about January 4th. Should we continue as we're planning in these 2 weeks, or should we do something different? So let me be very clear. If COVID continues to grow at the pace it's growing, we will very likely not only freeze schedules that are in existence, but begin to cancel elective surgeries. We will need to do that to ensure that we have enough capacity in our hospital system to care for patients with COVID. That's how serious we consider the current situation within this region. This will be identical to what we did in the spring when there was a surge in COVID patients and we postponed elective, non-urgent surgeries to create capacity. So that's not great news, but I would say that there's something everyone can do to help with this. Everybody sitting in the audience, all the press, and everybody watching this press conference. You can do what I said at the beginning of my presentation here. You can play a role in controlling the pandemic by following those 3 simple rules: wear a mask, social distance, and wash your hands. Very, very important. And there's probably one more thing you can do, which I think Dr. Liebers will speak about, and that's make the right choices this holiday season about how you behave and things that you do. So with that, I will turn it over to Dr. Stephen Hanks.
Thank you, Dr. Venditti. Good afternoon. I'm Stephen Hanks. I'm the Chief Clinical Officer at St. Peter's Health Partners. I do want to talk very briefly about the surge here. We are experiencing just about every day now new records in the numbers hospitalized in the capital region. We have far exceeded the numbers that we experienced in the spring. And it's very, very interesting from an epidemiologist point of view as to how this pandemic has spread. It came into our shores in the winter, really hitting the East Coast and the West Coast nearly simultaneously, and then started spreading from there. As a result of the actions taken by public health authorities and governors in states like New York, where we moved to lock down and then moved to a tiered emergence, we were able to beat back the growth in the pandemic and achieved by really Memorial Day a relatively low level of activity where we had increased testing capacity, but our test positivity rate was at or below 1%. And that continued along pretty much all summer. There was a very, very slight ripple, I wouldn't even call it a wave, in the July-August timeframe where the numbers went up ever so slightly. Even at that point, though, they only achieved about 1/3 of the height that they had achieved in the initial winter wave. And then, beginning on or around October 1st, we started to see the cases increasing across the region. And this was at the time where the Midwest, the middle of the country, was most heavily invested at this point with the virus. So the virus had come around the perimeter of the country, had moved centrally, the central portion of the country was surging, and then, like an accordion, it started moving back out again, because we did not have herd immunity, and we still do not have herd immunity, despite the level of activity of disease we had in New York back in the winter. And just as Dr. Fauci had predicted, we've been watching these metrics on a daily basis. We look at the numbers in the hospitals. We also look at the number who are testing positive of all the tests that are done in the region, and that number has gradually creeped up. It actually hit a plateau roughly 7 to 10 days prior to Thanksgiving, and then, just as Dr. Fauci had predicted, 3 days after Thanksgiving, that test positivity rate resumed a northward trend with a higher slope. And here we are now, coming into a longer, more extended holiday season than what the Thanksgiving holiday portended. And we've got a baseline test positivity rate that is roughly double what it was prior to gatherings at Thanksgiving. And once again, we've hit a plateau just below the 7% mark in terms of test positivity rate. And our big fear and our plea to our community, our big fear is if people do not heed the counsel, and they'll hear a little bit more from Dr. Liebers about this, we're going to see that test positivity rate tick up again, and this will turn into more hospitalizations and get us to a point that Dr. Venditti had referred to, where we have to think about curtailing services to patients. In terms of beds, we've been asked, are there going to be enough beds? Just about all of us have the ability to almost double the number of beds. We don't believe we're going to have a bed problem. We don't currently have supply problems. We don't currently have testing problems. Those things at the current moment are relatively stable. We do not believe we'll have to get into field operations where we open up beds in a convention center or a hotel or something like that. What we're worried about is our ability to staff those beds to care for the population of patients that we see is coming somewhere on the order of mid-January into and around the Martin Luther King holiday, which is really where we feel it's going to be the highest level of activity here in the capital region. So as the governor has been saying, New Yorkers have an ability through their actions to change our destiny as it relates to this. And so my plea to all of you is, in this holiday season, may the music you listen to be, there is no place like Home Alone for the holidays, because that's really what the message needs to be, as sad a message as that is. But that's the message that will keep us and our loved ones as safe as possible. So at this point, Dr. Liebers from Ellis is going to review with you some of the important steps you can all take to assist your hospitals, so that we do not become overwhelmed. Thank you.
Thank you, Steve. And I may sound like a broken record, because I think there are things that Dr. Venditti has said, Dr. McKenna has said, and Dr. Hanks has said that do bear repeating. So Dr. Hanks referred to the percent positivity that we use. It's called the 7-day rolling average. It's a number that reflects how much transmission is occurring in the community. And even since November 1st, we've seen that in the capital region go from about 2% among all the people tested to now 7%, and in Schenectady County, even higher than that. So we are seeing a true increase in transmissibility. Also, to reflect on what Dr. Hanks said, we saw a plateau a little bit before Thanksgiving. We're seeing a little plateau now. That plateau represents an opportunity for us to decrease the rate of increase. We're probably going to see some increase, but decrease that rate of increase that could have tremendous, profound effects on our healthcare system. It's interesting, we've made a lot about the danger to healthcare workers in caring for COVID patients. What we've seen actually over the course of this pandemic, that our healthcare workers, using appropriate PPE, appropriate masks, we use face shields, we use gowns, we use gloves, have been very well protected even when caring for patients face to face. It's actually been extraordinary. However, our healthcare workers have still been getting sick. Where are they getting sick? They're getting sick at home. They're getting sick from family members who are bringing COVID-19 into the household and spreading it to the healthcare worker. It has been really striking to me to see key medical personnel call me and say, oh golly, my son came home from college, he's COVID positive, and then that person turned positive. Or my wife has been COVID positive, now we lose a healthcare worker for 10, 14 days. The governor has shown us statistics in his briefings that have shown a preponderance when contact tracing has been utilized of spread recently, over 70%, 75% of cases being traced to small indoor gatherings. Gatherings, of 10 people or less probably. We've talked about 10, but even less gatherings. People from various areas traveling, relatives coming from different households, the chain of transmission stretching way out into the community and transmitting in these small gatherings. So here we're coming up to, we've had Hanukkah, we have Christmas, we have Kwanzaa, we have this tremendous, beautiful holiday season, and we all kind of share New Year's as well. What have we ordinarily done? We've gathered small, large gatherings. I used to have 30 people at my house for Christmas dinner. We, as a community, can tremendously impact the health of our citizens, the impact on hospitals by home alone for Christmas. That is, household celebrations. Use electronic media, Zoom, FaceTime, to gather with your loved ones, but to keep the celebrations really as household celebrations. I'm going to reiterate as I end what Dr. Venditti said. We know what the approach we have to take. Masking, really at all times when you're out in the community, really indoors and out for the most part. Social distancing, 6 feet. It's a good number. 12 might be better, but 6 is good. We know the transmission is droplets, person-to-person transmission. Avoid indoor gatherings. And of course, wash hands, wash hands, wash hands. Really simple stuff. And now we're really asking the community to do one more thing. Stay home for Christmas, stay home from New Year's, flatten that curve, keep it flat like it is right now, and help us in the healthcare system to take optimal care of this community.
Thank you all. So to summarize, a dozen area hospitals meeting 2 to 3 times a day, 7 days a week, trying to be sure that we're prepared for anything in the region. Number 2, vaccine is here. Frontline staff are being vaccinated, and a vaccine plan for the region to be rolled out very soon. On the issues of what you can do to protect yourself, I want to make one final point. We absolutely underscore and emphasize everything that's been said about mask wearing, social distancing, washing hands. It is important for you to remain healthy as well. We're about to enter a new year. Many people make resolutions. I often ask, since this has been going on since April, how many people have heeded the advice that it's probably a good opportunity to stop smoking, to control our blood pressure, to lose weight, to exercise more, to take better control of our diabetes. We know these are risk factors that make people more at risk for being sick if they get COVID. Again, emphasize that if you can do a better job of controlling your blood pressure, if you can quit smoking, if you can lose some pounds, if you can exercise more, these are things that will protect you beyond COVID, and they're things that you should consider this holiday season as well. That being said, we're happy this time to take any questions, and if anyone who needs to come up, I'd be happy to have them come up to help answer that question. Yes?
Hi, Leandra Rosa with Channel 6 News. You said Albany managed the hub for the vaccine. Describe what that means when it comes to distribution. Are you giving the shot, or are you getting it and then spreading it to the healthcare providers and pharmacies and the rest of it?
It's a great question. As the regional hub lead, Albany Medical Center is in more of a coordinating role. We're already setting up our task force, which, as I mentioned, has 60 different members from the community on it. We're also creating a vaccine network, which includes all the different counties and the county health departments. The vaccine that we have received on this campus was primarily and initially for our frontline staff. However, a recent amount that we got is also to be used in part for people in the community who fall into certain categories. EMS workers, individuals who are part of OASIS or OMRDD, funeral home directors, medical examiners, coroners. There's a subset of people that all the hospitals have to use some of their vaccine for in what's called Tier 1A. When you get beyond that, when you get to other tiers, 1B, 1C, or even the ones below that, it is likely at that point the vaccine will go directly to other areas where they'll set up pods, where there'll be a place of distribution. We'll be working to be sure that all that's done in an equitable way, to make sure we put out communications on that, to try to break down any barriers, to try to identify voluntary staff, to work with our task force to say which vulnerable populations are underserved by the vaccine. Historically, ethnic minorities, people with disabilities, homeless, people who live by themselves, people who live remotely. So we have to have really serious efforts to make sure we reach out to those populations as well. So the role of the hub is a lot of different layers, but it is not specifically to vaccinate everybody. That will be done at county departments and with the help of primary care practices as well. Yes.
When it comes to then moving through those phases, who decides when you move on to the next phase? Is that something that all the states will follow at the same level? Counties?
So it's a great question. So there is a published guideline, a tiered system. We're currently in phase 1A, and the state will tell you when you can move to the next level. You need permission to do that. And typically, you would expect that you would have to report numbers up, that a certain percentage of people in that tier have been vaccinated or declined, and then you can move on. So we have a liaison from the state who is assigned specifically to the Capital Region Hub. That individual will be part of our task force, and we'll be working closely with that individual to help us to make that decision. And we'll be working with all the area hospitals as well. Looking around, I know that all of them are also in their communities taking the very important role of vaccinating their EMS workers and those other frontline people.
Are you afraid not enough people will get the vaccine for it to be effective? And if so, then how do you educate the public in order to give support?
I'm not afraid, but it is something that we are mindful of. I believe that the data on the Pfizer and the Moderna vaccine are extraordinary. 95% effective rate, very limited side effect profile. All different populations benefited from the vaccine. One of the roles of the task force is to be sure that we're out there in the public communicating. You play a very important role. This is one of the reasons why we wanted to do this, to educate our public. We'll have a lot more communication tools in the weeks and months ahead, but it starts with all of us saying that the vaccine is safe and effective and encouraging people to take it. I would ask maybe one of my infectious disease colleagues to speak about what it means to have herd immunity. Could you speak a little bit about that, Dr. Lievers, and what a good number of people in the community is needed to be sure that we get the vaccine out of our region?
Well, we have all heard a lot about herd immunity in the past few months. Herd immunity essentially is when the immunity is present in enough of the population to shut down spread, such that the likelihood, the probability of an infected person coming into contact with a non-immune person and continuing a chain of transmission essentially gets shut down. Herd immunity can be affected by letting the disease spread through the population. We know that Sweden tried that and then backed off from that approach based on the damage it really does. Vaccines do the same thing. So we are trying probably to get a 70% or more percentage of our population vaccinated. If we get to that, we think herd immunity will be able to bring this pandemic to a close.
And to that point, when the public has been surveyed about their willingness to take the vaccine, most published surveys say that 80% have said yes. And I believe over time that number will go up when they see that those who are vaccine hesitant, when they see that their neighbor, their colleague, their coworker has gotten the vaccine and has not had any side effects that are concerning, they themselves, I think, will be likely to get it as well. So I think that 20% that are hesitant will shrink over time.
Do you have a number for how many doctors or healthcare workers in the hospitals have said yes compared to no?
What I can tell you on this campus is in the first week when we rolled it out to the emergency department, to the ICU, to the COVID floors, it was overwhelmingly yes. And in fact, the allotment we had, we went through all of that within the first week. So I think the response, I'm looking around the room, in all the hospitals has been overwhelmingly positive.
I heard no no's, to tell you the truth.
So Dr. Liebers from Ellis Medicine says none of his staff have refused the vaccine.
It really is the opposite. People are tripping over themselves to get the vaccine, and we're getting calls from people whose turn hasn't come yet. When am I going to get my vaccine?
Right.
So it's really encouraging.
And to that point, we're working with the county health departments and others to set up vaccine areas so that we can move through those tiers, including not just the hospital workers, but the community, as quickly as we can get the vaccine into the region. Anything else? Okay, well, we thank you for coming. We thank you for taking this very important message back to the public, and we'll call again when we have some more news to announce. Thank you.
Thank you.